Hi, I'm Sarah from Woodborough House Dental Practice, and I'm going to tell you a few things about having fixed orthodontics or bracket and wire braces. So if you're having bracket and wire braces, it'll probably take between 12 and 36 months. Louise, our orthodontist, will tell you exactly when you get your treatment plan. You'll have reviews every 4 to 8 weeks after having the braces fitted. You still require to see a general dentist, either at Woodborough or at your own dentist, to make sure that the rest of your teeth are being looked after and that you're having regular hygiene appointments. This is particularly important when you've got braces on. When you've got braces on, it's very tricky to clean around the brackets, so you have to make sure that you're being even more careful than you would normally. So please ask Louise for advice if you're struggling with your oral health care. If you play contact sports, it's particularly important that you still wear a mouth guard. You won't be able to wear a normal mouth guard that you're fitted for. So if you go online and Google mouth guards for orthodontics, you'll be able to obtain one, or at a sports shop. Musical instruments, it's fine to keep continuing to play a musical instrument. If you play a woodwind instrument, it may feel a bit peculiar initially when you're playing your instrument, but you will become very used to the braces being in place and you will be able to play it as per normal. So after you've first had your braces fitted, it's really important to expect your teeth to be a little bit painful. I always say to my patients, it's like your teeth have been at the gym, they've been exercising, so they will feel quite tender when you're eating. That's completely normal. That wears off after a day or two, but every time you have a new wire put in at a review appointment, you will have this tenderness to your teeth. So don't worry about that. If you need to, take some painkillers. That's a good thing to do. Be very careful what you eat when you have your braces on. So anything very hard or very chewy could cause one of the brackets to dislodge. If that happens, do not worry. Just ring up the practice and we'll arrange to have the bracket put on again for you. Initially, when you first have your review appointment, the wire is changed, and that means there's a lot more force in that wire, which can sometimes dislodge a bracket. So again, ring up if that happens. The wires themselves can be a little bit sharp and pokey. Sometimes they need to be adjusted or cut, but often what we suggest is you take a little bit of the wax that Louise provides for you, soften it in your fingers and pop it over the end of the wire or on the brackets, because when you first have braces, your lips and your cheeks and your tongue will play with the brackets and you will get a little bit of ulceration. Again, this is completely normal. The other thing you may have is what's called a bite razor, which is a little bit of filling material that opens your bite, so you can't close your teeth completely, so it allows movement of the other teeth. This is always put on in a different colour, a bright blue or pink or orange, so you'll be able to see it. If this comes off for any reason, again, that can easily be put back on at the practice.